Hi, so my name is Pamela Reyes, and I'm doing my presentation on disorders of the cardiovascular system because cardiovascular disease is the number one cause of death in the US. So, we're going to start with how your heart looks like and how does it work. So this is how your heart looks like, and the general concept of how it works is that the left atrium and the left ventricle takes up oxygenated blood from the lungs and pumps into the aorta, which then goes throughout the rest of your body, and then the right atrium and right ventricle pumps unoxygenated blood into the lungs through the pulmonary artery. Next, so what is the most common heart disease? The most common heart disease is coronary artery disease. It is a common heart condition that affects the major blood vessels that supply your heart muscles. And how does this happen? So usually the buildup of fat and cholesterol in the artery walls builds up plaque that reduces blood flow to the heart and other parts of the body. And the buildup of plaque in the artery walls is another cardiac disorder called atherosclerosis. And what are the symptoms of coronary heart disease? Usually chest pain and discomfort, pain in places like your neck, your upper belly, your back, your jaw, and pain and numbness in your and weakness in your legs and your arms, usually due to lack of circulation. So, what can coronary artery disease lead to? It could lead to other cardiac disorders such as a heart attack or myocardial infarction, a stroke, and apnea. Um, uh, a heart attack is sudden blockage of the coronary artery. A stroke is blockage or rupture of a blood vessel in the brain, and agony is chest pain due to not enough oxygenated blood. So this is a diagram of the progression of coronary artery disease. Okay, so what are some risk factors for developing heart disease? Age, as you get older, your heart and your arteries get weaker. Sex, men are usually at greater risk of heart disease. Family history, if your family members have it, you are more likely to get it. Smoking, having diets high in fat, salt, and sugar, and cholesterol can lead to high blood pressure, high cholesterol, diabetes, and obesity that could then lead to heart disease. Lack of exercise, unmanaged stress, and poor dental care. Poor dental care is because if you don't take care of your teeth and your gums, you could develop bacteria that could go into your bloodstream and cause inflammation of the inner lining of the heart called endocarditis, which is another cardiac disorder. So how can we prevent this? We can prevent this by not smoking, having a healthy diet, daily physical activity, reducing and managing stress, getting in control of your high blood pressure, cholesterol and diabetes, and getting enough sleep, which is extremely important and often overlooked. So, how do we encourage prevention? We could do it through spreading knowledge and awareness, promoting healthy habits for yourself through a reward system, joining a community of support through social media, school, and workplaces, having support system with your family and friends, and not being afraid to talk to your healthcare provider because they could give you personalized advice and motivation and could give you more knowledge about what you're going through. And these are the resources that I use for my project. Thank you so much for watching.